Hi, my name is Dr. Naomi with Yost Wellness Center, and today I wanted to talk about type 1 diabetes. Hopefully you were able to watch my other video on type 2 diabetes, but today I wanted to talk about type 1 diabetes. What is diabetes? It's when you have too much sugar in the bloodstream. So let's review how you get that. So whenever you eat, you break the food down. Here's your gut. You break it down to glucose. And every cell in the body needs glucose for energy. So every cell here has to take up glucose. How do you get that into the cell? The pancreas makes insulin. The beta cells of the pancreas make insulin. And then every cell of your body has a receptor site for insulin, and that allows insulin to go in the cell, and then glucose, that's your transporter to allow glucose into the cell. So insulin is really a big deal. Type 1 diabetics do not make insulin. So how does this happen? It's an autoimmune attack. And how do you get an autoimmune attack? It is by leaky gut. Most research now shows that a lot of these autoimmune diseases are caused by a leaky gut. Hopefully you watched our webinar by Dr. Knudsen on leaky gut. Please watch it if you haven't. So how does this happen? How do you get a leaky gut? It's by medications, food intolerances, food allergies, stress, high cortisol levels can cause it. Bacteria can cause it, viruses can cause it. So what happens in a leaky gut? The inner lining of that GI tract becomes permeable. So the true name for this is called intestinal permeability. So it's not supposed to, remember, your immune system in this GI tract is supposed to keep the good things in and the bad things out. But what happens when things leak through this GI tract? Then you have a very strong immune reaction. Your immune system is now in overdrive. So it now starts confusing these things with your body's own tissue. And so in type 1 diabetes, it actually attacks some of the cells here in the pancreas, actually the glucagon cells in the pancreas. And then you eventually, the ultimate thing that happens is the pancreas stops making insulin. These cells are just destructed by the immune system. So remember, you cannot take up glucose without insulin. So it's really a big deal. Type 1 diabetics actually have to take shots or use an insulin pump. They can't live without the insulin. They just can't live without it. So we would have no energy if you didn't have insulin. So it's really a big deal. But what I wanted to go back and talk about it is the leaky gut, because this is preventable. I'm actually a type 1 diabetic, and I feel like if I had known about this 25 years ago, I think I probably could have prevented my diabetes. I know that we can help manage a lot of autoimmune diseases from getting worse. We can also bring them into remission. Some we can, some we can't, but we still don't want them to progress. When you have one autoimmune disease, you're at a higher risk for multiple autoimmune diseases. And how are you going to correct this? With this repairing this leaky gut. So here at Yost Wellness Center, we really focus on this. We focus on the gut first. That's our phase 1. We eliminate things that would cause any strong immune reaction and that permeability, and we give you a lot of nutraceuticals that help repair this inner lining of the GI tract. It's very, very important. 80% of your immune system is in the GI tract. So this is the reason that we focus on that. We also test for autoimmune markers to see if you're at a higher risk for those types of things, and do a lot of other testing, because we just look at the body as a whole, not as a disease process. So we would be glad to help you here. It's a big passion of mine to help people prevent autoimmune disease and also help manage it. It's such a big deal for your overall health. Thank you very much for your time, and I hope this was helpful. A simple explanation of type 1 diabetes. Thank you.